So what happens when the very system that's supposed to save us in a disaster is a victim itself? You know, when the rescuers are the ones who need rescuing. How does healthcare even begin to work? Well, we're about to dive into that.
Look, this isn't some line from a disaster movie. These are the actual words of Dr. Mohammed Kachirai, the provincial health director of Hatay, who lived through this absolute nightmare. And that statement, it's about more than just buildings. It's about the collapse of hope itself.
And that really brings us to the core question here. In those first critical moments, when there's no communication, roads are gone, and every system you count on is just gone, how does this invisible health system somehow manage to rise up from the rubble? Let's get into it.
Okay, to understand this, we can't start with tech or logistics. No, we have to start with the most basic, and honestly, the most fragile part of the whole system, the people.
This right here, this gets to a tragic, fundamental truth of what happened. In those first hours, the person pulling someone from the wreckage was often the same person frantically looking for their own family. They were the hero and the victim, all at the same time.
So you can imagine the impossible conflict going on inside their heads. On one hand, you have the professional oath they took, that deep-down duty to save anyone and everyone. But on the other hand, you have the most powerful human instinct there is, the need to find and protect your own family. I mean, how do you even make that choice?
And out of that impossible situation, these stories of almost superhuman sacrifice started to emerge. We're talking about medics using their own motorcycles to get to places ambulances couldn't dream of reaching. Staff who worked for 72 hours straight, with no clue if their own families were alive or dead. And even leaders who are managing command centers while grieving the loss of their own children.
These people, they were the reason the system didn't just completely disappear. But this whole painful experience taught one very, very clear lesson. Heroism isn't a strategy. You just can't build a disaster plan that depends on people performing miracles. It's not sustainable.
So that lesson led to this, the sister hospital system. And the logic is actually pretty brilliant and incredibly humane. When a disaster hits, the first official duty of local healthcare workers is to make sure their own families are safe. And at that exact same time, a rested, fresh team from a pre-assigned hospital, maybe hundreds of kilometers away, is already on the road to come take over. It keeps the care going without asking the impossible from people who are victims themselves.
Okay, so even with the plan for the people, the system ran into another massive wall, a total logistical meltdown. This is where the chaos really took over.
You know, we usually think the biggest problem in a disaster is scarcity. Not enough medicine, not enough food. But what happened here showed something totally different. The real enemy wasn't a lack of supplies. It was a complete and total breakdown of information, of coordination.
It was just one failure after another. The warehouse is filled with supplies, buried. The roads to get to them, gone. The digital systems for saying, hey, we need this, offline. And then, to top it all off, tons of well-meaning aid started pouring in. But it was all unsorted, creating this whole new logistical nightmare. A doctor on the ground literally didn't know who to ask for something as simple as gauze.
And yet, in the middle of this absolute system failure, something incredible happened. An instinct just kicked in. Teams on the ground, without any orders, just started setting up field hospitals right in the gardens of the hospitals that had collapsed. And they did it in as little as 3 hours. This wasn't in some manual. It was a pure gut response that saved hundreds and hundreds of lives.
That incredible instinct also showed just how badly they needed to shift from reacting to proactively preparing. And Turkey's whole history with disasters is really a story of evolution, one written through some very painful but very valuable lessons.
Yeah, you can see this evolution so clearly. Back in the 1999 earthquake, the big lesson was that you need specialized rescue teams. So MKE was created. Fast forward to 2023, and the new lesson was, even the best teams in the world are useless without logistics and tech. And from that hard lesson, AFETech was born. So what is AFETech? The idea is so simple, it's genius. When a first responder in the field says something like, man, I wish we had a device that could listen for survivors under the rubble, AFETech is the unit that connects that need directly to, say, a university engineering department or a tech company that can build it. It basically closes the gap between having a problem and creating a solution in real time.
So, how do all these lessons from the past actually shape what you do for the future? Let's switch gears and look at the biggest worry of all, the expected Istanbul earthquake.
And this is the real game changer. The planning now, it's not based on guesswork or what people think might happen.
It's driven entirely by data, by advanced simulations. They're asking super detailed questions. Which exact hospitals are likely to collapse? How many thousands of injured people will we have in the first hour? Down to how many tourniquets will we need?
So this new way of thinking is built on 3 really concrete strategies. First, targeted kits. Each hospital gets a prepackaged kit with everything they'll need for the first 24 hours. Second, smart storage. They're putting these kits in buildings that have been scientifically identified as having a very low risk of collapse. And third, all of this, every single item in those kits, is based on scientific data, not a hunch.
And behind this whole strategy, there's one single number that guides everything: 24. The core idea is that a city has to be able to survive and treat its own people by itself for the first 24 golden hours before any major outside help can get there. Everything is being built around that one guiding principle.
It really does seem like a massive leap forward, right? Shifting from just reacting to actually preparing. But for this entire puzzle to work, there's one last and maybe the toughest piece that has to fall into place.
And that piece is all about economic reality. There's a basic conflict here. If you're a private company, it just makes zero business sense to spend millions on supplies and stockpile them for a disaster that might not happen for years or ever. That's where the state has to step in. It has to be the one to create the rules, the regulations, the incentives that make sure the private sector is also prepared.
Because in the end, building a society that can withstand a disaster like this isn't just the government's job. It takes what you could call a collective intelligence. You need the public authorities to set the course, but you need industry to actually build the solutions. You need civil society to provide those support networks, and you need every single citizen to be informed and ready.
Which leaves us with this final, and I think really critical question. This isn't just a problem for experts or governments to solve. It is a shared responsibility for every single one of us. So are we actually ready to build this collective strategy together before it's too late?